10. Folic acid. Intake. Take a prenatal vitamin with folic acid to reduce the risk of neural tube defects. 11. Reduce toxin exposure. Limit exposure to environmental toxins that can impact fertility. 12. Know your ovulation signs. Recognize ovulation signs such as changes in cervical mucus and basal body temperature. 13. Optimal sexual positions. Certain positions may increase the chances of sperm reaching the egg. 14. Regular intimacy. Aim for regular intercourse, especially during your fertile window. 15. Reduce stress. Practice stress-reducing techniques like meditation or yoga to promote fertility. 16. Avoid lubricants with spermicidal agents. Choose fertility-friendly lubricants to enhance sperm motility. 17. Limit hot baths and saunas. Excessive heat can negatively impact sperm production, so avoid prolonged exposure. 18. Partner's health matters. Ensure your partner maintains a healthy lifestyle for optimal sperm quality. 19. Medical checkup. Visit a healthcare professional for a preconception checkup to address any potential issues. 20. Patience and persistence. Understand that conception may take time. Stay positive and persistent. Remember, these tips are general guidance. If you encounter challenges, consult with a healthcare professional for personalized advice.
10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant, it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms-to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Be sure to talk to your doctor if you're concerned. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms-to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. And remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks, pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavier bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
Oh hey everyone, welcome back to. Today we have a topic that's close to the hearts of many expecting mothers out there. Maintaining fitness while pregnant. Whether you're a mom-to-be or just curious, this video is packed with tips to keep you active and healthy throughout your pregnancy journey, so let's dive in. Segment 1. The importance of staying active. Pregnancy is not a reason to hit pause on your fitness journey. In fact, staying active during this special time can bring a world of benefits, from boosting your mood to improving your posture and sleep. The advantages are endless, but of course safety is key, so let's talk about the types of exercises that are perfect for moms-to-be. Segment 2. Safe and effective exercises. Now, when it comes to exercising during pregnancy, it's crucial to choose activities that are gentle on your changing body. Opt for low-impact exercises like walking, swimming, and prenatal yoga. These not only keep your heart pumping but also help in maintaining muscle tone and flexibility. Remember, always consult with your healthcare provider before starting any new workout routine. Segment 3. Tailoring your workouts. One size doesn't fit all, especially when it comes to pregnancy workouts. Tailoring your exercises to your individual needs is key. If you were active before pregnancy, you might be able to continue with modifications, but if you're new to exercise, start slow and gradually increase intensity. Our bodies are incredible, and adapting our workouts ensures a healthy journey for both mom and baby. Segment 4. Listen to your body. Pregnancy comes with its own set of physical changes, and it's essential to listen to your body. If something doesn't feel right, modify or skip it. This isn't the time to push your limits. Pay attention to your energy levels and give yourself the rest you need. Remember, a happy and healthy mom means a happy and healthy baby. Segment 5. Building a support system. Host. Staying fit during pregnancy is not just about the physical aspect. Point 4s. Greater than. It's also about having a strong support system. Connect with other expecting moms, join prenatal fitness classes, or even involve your partner in your workouts. Having a community around you can make this journey even more enjoyable. Conclusion. And there you have it. Tips and tricks to stay fit and active during pregnancy. Remember, every pregnancy is unique, so consult with your healthcare provider to create a personalized fitness plan. If you enjoyed this video, give it a thumbs up, and don't forget to subscribe for more content. Take care.
Hello everyone, welcome back to our channel. Today, we are going to discuss the early signs of labor that expectant mothers should be aware of. If you're new here, consider subscribing and hit that notification bell so you won't miss any updates. Let us get started. The first sign is lightening. This occurs when the baby drops lower into the pelvis, relieving pressure on the diaphragm. Moms-to-be might feel increased pelvic pressure and notice their baby bump is lower. Braxton Hicks contractions. Next up, Braxton Hicks contractions. These are irregular, painless contractions that help prepare the uterus for labor. They may feel like a tightening or hardening of the belly. Increased discharge. As labor approaches, you might experience increased vaginal discharge. This is known as the mucus plug, and it protects the cervix during pregnancy. Losing it is a sign that labor could be near. Nesting instinct. Feeling an uncontrollable urge to clean and organize. That's the nesting instinct kicking in. Many expectant mothers experience this surge of energy right before labor. Diarrhea or nausea. Hormonal changes can lead to gastrointestinal changes too. Diarrhea or nausea might occur as your body prepares for labor. Back pain. Persistent lower back pain can be a sign of labor, as the baby's head presses down on the pelvis and sacrum. Rupture of membranes. When the amniotic sac ruptures, known as the water breaking, it's a clear indication that labor is imminent. This might be a gush of fluid or a slow trickle. Contractions. Last but not least, true labor contractions. These are regular, progressively intensifying contractions that help the cervix dilate and efface. Conclusion. Remember, every pregnancy is different, and not all women will experience these signs in the same way or order. If you notice any of these signs or have concerns, always reach out to your healthcare provider. Stay tuned for more pregnancy-related content and take care. See you in the next video. Outro. Thank you for watching. If you found this video helpful, give it a thumbs up and share it with others. Don't forget to subscribe and hit the notification bell to be notified of our future videos. Stay safe and take care. Bye.
Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid high-mercury fish, such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of Listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw spruce. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider for personalized advice. If you found this information helpful, don't forget to like, subscribe, and share. Until next time, take care.
Balancing Act. A guide for pregnant working women. Managing work while being pregnant can be a challenging but manageable experience. Here are some tips for pregnant women who are also working. 1. Communication with your employer. Inform your employer about your pregnancy in a timely manner. This allows them to make any necessary adjustments and accommodations. Discuss your plans for maternity leave and ensure you understand your company's policies regarding pregnancy and parental leave. 2. Schedule regular prenatal checkups. Attend all necessary prenatal appointments to ensure the health of both you and your baby. Communicate with your employer about these appointments in advance and discuss any necessary time off. 3. Flexible work arrangements. If possible, explore flexible work options such as telecommuting or adjusting your work hours to accommodate your changing needs and energy levels. 4. Take breaks and rest. Listen to your body and take breaks when needed. Short breaks can help alleviate fatigue and stress. Ensure you have a comfortable chair and workspace to support your changing body. 5. Stay organized. Use tools like calendars, planners, or apps to stay organized and manage your workload efficiently. Prioritize tasks and focus on what's most important to reduce stress. 6. Delegate tasks. If you have the opportunity, delegate tasks that can be handled by others. This can help lighten your workload and reduce stress. 7. Stay hydrated and eat well. Proper nutrition is crucial during pregnancy. Stay balanced, healthy meals to maintain your energy levels. 8. Seek support from colleagues. Let your colleagues know about your pregnancy, especially if it may affect your work in any way. They can provide support and understanding. 9. Create a comfortable workspace. Make your workspace more comfortable by adding cushions or ergonomic accessories as needed. 10. Know your rights. Familiarize yourself with your rights as a pregnant employee. Understanding your legal protections can help ensure fair treatment in the workplace. 11. Plan for maternity leave. Work with your employer to plan for your maternity leave. Make sure you understand how your role will be covered during your absence. Remember, it's essential to prioritize your health and the health of your baby during this time. Don't hesitate to communicate openly with your employer, seek support from your colleagues, and make adjustments as needed to manage the demands of both work and pregnancy.
IUI stands for intrauterine insemination, which is a fertility treatment used to increase the chances of pregnancy. The procedure involves placing sperm directly into a woman's uterus to facilitate fertilization. IUI is commonly used to treat infertility due to low sperm count, decreased sperm motility, or issues with cervical mucus. Prior to the procedure, the woman may receive ovulation-inducing medication to increase the likelihood of successful fertilization. IUI is a relatively simple and non-invasive procedure that can be performed in a doctor's office. It is usually painless and does not require anesthesia. The success rate of IUI varies depending on several factors, including age, fertility issues, and the number of insemination cycles performed. The risks of IUI are minimal, but there is a small risk of infection or discomfort. IUI is often combined with other fertility treatments, such as in vitro fertilization, IVF, to improve the chances of pregnancy. Overall, IUI can be an effective treatment option for couples struggling with infertility, but it is important to discuss all available options with a fertility specialist to determine the best course of action.
Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Title: How to Check a Pregnancy Test, a Comprehensive Guide. 1. Introduction. Welcome to our guide on how to check a pregnancy test accurately. 2. Importance of timing. Timing is crucial for accurate results. Discuss when to take the test for the best outcome. 3. Understanding pregnancy tests. Explain the types of pregnancy tests available, urine tests, and blood tests. 4. Choosing the right test. Guide viewers on selecting a reliable pregnancy test kit. 5. Reading the instructions. Emphasize the importance of thoroughly reading the instructions before starting the test. 6. Gathering supplies. List the necessary items needed for taking the test. 7. Collecting urine sample. Offer tips on how to collect a urine sample properly for the test. 8. Performing the test. Step-by-step demonstration on how to perform the test accurately. 9. Waiting period. Explain the waiting period before checking the results and why it's essential. 10. Interpreting results. Provide guidance on interpreting the results correctly, including what different symbols or lines mean. 11. False positives and negatives. Address factors that could lead to false positive or negative results. 12. Next steps. Discuss what to do after getting the results, whether positive or negative. 13. Seeking medical advice. Highlight the importance of consulting a healthcare professional for confirmation and further guidance. 14. Emotional support. Offer reassurance and support for viewers, acknowledging the emotional impact of pregnancy test results. 15. FAQs. Answer common questions about pregnancy tests, addressing concerns and misconceptions. 16. Tips for accuracy. Provide additional tips to ensure accurate results, such as testing in the morning and avoiding certain medications. 17. Handling results. Discuss how to cope with different outcomes and offer resources for support. 18. Partner involvement. Encourage involving partners in the testing process and decision-making. 19. Test disposal. Guide viewers on proper disposal of used pregnancy tests. 20. Conclusion. Summarize key points, reiterate the importance of accuracy, and offer encouragement to viewers.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes. Ten healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the